Today in this video, we are going to see what is antigen, what is antibody, what are the different types of antibody, and why specifically some people who have got 2 doses of vaccine also got a chances of reinfection. So this is a $1 billion question which will be answered at the end of this particular video. So welcome to Smartbox. This is your KG. First, we will see what is antigen. Any foreign particle which is entering into our body, and if it is capable of causing any disease or infection, then that particular particle is called as an antigen. This antigen may be a bacteria, this antigen may be a virus, this antigen may be a fungus. Okay. Second, we will see what is antibody. Once our immune system identifies that some antigen had entered into the body, it produces certain substances to neutralize it or to kill it completely. So any substance which is produced by our body against the antigen which have entered into the body, that particular substance is called as antibody. Okay, so types of antibodies. There are two different types: naturally produced antibody, and the second type is the vaccine produced antibody. So with respect to naturally produced antibody, there are two things which we are going to see. The first thing is the T cell and the second thing is the B cell. So with respect to B cell, there are two different types which we have already discussed in the earlier videos, that is immunoglobulin M or IgM, and the second one is immunoglobulin G or IgG. Okay, so these are going to provide us the immunity against any kind of antigen which is going to enter into the body. So first we'll see with the example. Let us consider a big house. So to protect this big house, they have got a dog which will be providing the first line of protection, and they have got the security which they are going to provide the second line of protection. And inside the house, they have got the bodyguards. They are equipped with AK-47 and special things like that, who are going to provide us the complete protection. Okay, suppose a thief is trying to enter this particular house. So the dog will go and attack that particular thief, and it also remembers, okay, this particular person is a thief. If he comes again, I will not wait to identify whether he's a thief or not, because already I have identified he's a thief. I'll keep in my memory. If he is coming again, instantly I will go and attack him. Unfortunately, this dog is not able to fight against the thief. The thief is overcoming the dog and is going to the next level. So here we have got the security. They are going to fight against this particular thief. But for a short duration only, they can fight against this particular thief. But they will give signal to the next bodyguard who is inside the house that I started fighting with a particular person. You be ready. If he comes inside, you kill him. That was the message which was given by the security to the bodyguards. So unfortunately, this security fellows are also not able to overcome the thief. The thief is entering to the next level. Here we have the bodyguards ready who will kill this particular thief or neutralize this particular thief. So here the house is nothing but our human body or the immune system. The pet dog which I mentioned, the first line of defense, that is nothing but the T cell. So any antigen which is entering into the body, the first line of defense will be provided by the T cell. If your T cell is so good, it will attack the virus, it will neutralize it, it will kill it then and there itself, and it will keep a strong memory. Okay, this is the antigen which have come, and I have provided certain amount of antibodies against this particular antigen, so that in future, if the same antigen comes into the body, T cell will not wait. It will immediately produce the antibody against that particular antigen, and it will vanish it then and there itself. Unfortunately, our T cell is not able to fight against the virus or the antigen. So the virus had moved to the next level. It started invading our cells. Now we have got our B cells. That is the security. So security is nothing but the IgM, immunoglobulin M. This is triggered within third day of infection or within a week of infection, and it lasts for a month or about 6 weeks. So they fight against the antigen very good manner. Unfortunately, if IgM is not able to do so, then we have got the IgG. Remember, IgM will be only fighting against the antigen. It is not going to give you the protection. But IGG will fight in a much better way, and it will offer you a complete protection. So again, This, like similar to T cell, B cell, that is IgM and IgG, will also have a strong memory that so and so antigen have come, this antigen will be of a particular shape. So to counterattack this particular antigen, I have to provide this type of antibody so that I can overcome the antigen. So I hope this example is clear to you. So next thing is the vaccine produced antibody. So here also we are going to give the virus by killing it completely or deactivating it partially. So our immune system will identify and it will produce the antibody against it. So in case if the original virus is coming and trying to attack, our B cell is already having a memory that I have to produce this antibody only against that particular virus. So without wasting time, it will immediately produce the antibodies so that you will be protected. We are actually focusing on getting this particular IgG antibodies only because T cells, they are going to be a first line of defense only. IgM, it is going to fight, but it is not going to offer you protection. This IgG is only going to offer you a complete protection, and it is also going to have a complete memory of the antigen as well as the antibody which is produced against that particular antigen. So on giving vaccines, you are going to develop this IgG antibodies only. So two things we have to note. Certain people will say in the first wave I think that I got COVID, but without taking much of medicines, I have managed myself. I took rest, I took some medicines, and I got myself recovered. Do I need to take vaccine again? See, I have mentioned about the T cells, right? In such type of people, the T cell has performed a major role. It had fought against the virus in a much, much better way, so that without moving to the next level, that is B cell taking in the role of fighting against the virus, T cell itself had completed the virus in a much better way, so it had eradicated it. Maybe it may be a mild infection, so that your T cell itself was capable to fight against the virus. But again, I told you, we need IgG antibodies. If you do an antibody test for these type of people who say that I think I got COVID positive, but I have got recovered without major medications or without being hospitalized, there will not be any specific antibodies against that particular virus. For example, we see COVID. Okay, he got a mild infection of COVID without, as it was mild, as his T cell was so good, he have recovered from that particular infection without major treatment or without hospitalization. But if you check this particular person's antibody, there will not be any specific antibodies, that is IgG antibodies against COVID-19. So it is the role of that particular person to get himself vaccinated so that his body now has IgG antibodies against the COVID virus. So that is going to give him a complete protection. The second $1 billion question, after taking 2 doses of vaccine, still they are saying I may get reinfection of COVID-19. Why is it so? First dose, you're going to take the second dose. After 2 weeks of time from your second dose, complete antibody production would have happened in your body, and your body is ready to face any kind of COVID-19 infection. So again, you have to give a time period of 2 weeks from the second dose. Okay, so the second thing what they are saying is like the amount of time which you are spending with the COVID-19 patient is directly proportional to the viral load in your body. Viral load, for example, if your body has if you're spending time with the COVID patient for about 15 minutes, okay, so the viral load in your body, for example, will consider 100 virus. Okay, some other person who is spending half an hour time with the COVID patient, so the viral load in this particular person will be somewhere around 200 or 300. So the viral load is directly proportional to the amount of time you are spending with the COVID-19 patient. For example, after 2 doses of vaccine, you have given a 2 weeks time period also. If the amount of antibody produced is lesser than the viral load, then obviously there is a chance for you to get reinfection. That is, the amount of antibody produced, for example, will say 100. The viral load which is there in your body is somewhere around 300. So viral load is higher than the antibody produced in our body. So in such kind of scenario, there is chances of reinfection. So how to determine? It is actually depending on your age. If you are at a young age, then the amount of T cell production or the effectiveness of T cell will be so good. So it will be taking care of all kind of infection, and it will have a better defense mechanism to get rid of this viruses, bacteria or fungus. Okay. So again, B cell, your immune system is directly proportional to your age and the comorbid conditions. So comorbid conditions like diabetes or blood pressure. Then if your age is high and if you're having some underlying comorbid condition, then the amount of antibody production will be varying significantly. So first thing, get yourself vaccinated. Whether you got infected with COVID, mild COVID infection, it is necessary to get yourself vaccinated so that you will develop IgG antibodies, which is only going to offer you complete protection against COVID-19. And stay indoor, never ever step out for unnecessary reason, so that you will not get in contact with any COVID-19 patient, and maintain your immune system in a proper way. I guess this video was useful to you. So in case if you like this video, give a like, share to the people whom we feel this will be useful, and subscribe to Smartbox. Thank you.